I'm Jack Dillenberg, and I'm the inaugural dean of the Arizona School of Dentistry and Oral Health. When we started this wonderful school, there were a couple things that were guiding principles. That we followed some of the thinking of Andrew Taylor Still, the founder of osteopathic medicine, and his sensitivity to patients and wanting to make a difference and wanting to serve. We were the first dental school in America that had oral health in its name. Every other school was a school of dental medicine, school of dentistry. We wanted to be a school of dentistry and oral health. Why? Because it's not just about the teeth. It's about the person attached to the tooth, the family attached to the person, and ultimately the community attached to that family. You know, whole person healthcare relates to what we do in a very significant way, because now the research has shown that our model is effective and right on track because so many health issues are linked and associated with the oral cavity. ASDOH was the second school in the United States to have social workers working on the clinic floor side by side with our students. Why? Because patients come to dental schools with other issues than just their dental problems. They are poverty, obesity, substance abuse, victims of domestic violence, all sorts of issues that they have that our doctors, our student dentists need to be aware of for them to be effective. Otherwise, they're just tooth technicians. And that's not what this healthcare system needs now. We need to produce healthcare professionals with emphasis on oral health that understand that linkage, that understand and have the confidence to reach out and talk to osteopathic physicians, allopathic physicians, PAs, other healthcare providers with that understanding and knowledge of how it all interrelates in a whole person healthcare environment. Serving the underserved is a critical part of ATSU, Andrew Taylor Still's initial vision when he started his osteopathic medical education model way back when in Kirksville, Missouri. We've taken that even a step further. We know that our students will gain more clinical experience, develop their passion and compassion by working with the underserved at an early stage in their professional development. During the fourth year, our students go out to rotation sites, community clinics throughout the United States, from the East Coast to the West Coast, from north to south, where they have the opportunity in a mentored environment with an adjunct faculty member that's been calibrated, that has been selected because they're caring, they're compassionate, they want to be part of enriching the experience of this young professional to help create that caring, compassionate healthcare provider for the future. In these clinics throughout the United States, they're seeing 8 to 12 patients a day doing comprehensive care dentistry, whether it be implants, surgical flaps, molar endodontics, very complex procedures that a lot of dental schools don't have their undergraduate, pre-doctoral dental students do. They have their residents do. But our students have that capacity, that experience, that ability, that interest in doing these clinical procedures in an environment where they're being mentored one-on-one. For those students that come to ASDOH and experience the innovative technology, experience the caring, compassionate faculty with great clinical skills for special needs, for medically complex. And then they have the opportunity in their fourth year for their external rotations in these community sites where they're seeing many patients in a variety of settings. Now they've got the competence, confidence, the skills, the leadership ability to be that oral healthcare provider that's needed in the community when they graduate to bring together this integrated healthcare system that the United States desperately is clamoring for right now, linking physicians, dentists, nurses, behavioral health scientists, all these folks that are focusing on this patient-centered, whole-person health environment. Our graduates are able to do that. They're able to assimilate well into the system. They're becoming leaders within the system. Many of our graduates, when they come out of school, we're the only dental school where it requires students to get a certificate in public health. They can take those credits on the certificate in public health online and roll it into a master's of public health. This past year, we had 23 students graduate with a master's of public health along with their dental degree. That's unique. No dental school is anywhere near close to that in granting dual degrees like that. What does that mean? That means this individual now has graduated dental school with a skill set that is uniquely qualifies them to be a leader within that dental community where they want to practice. They can be the dental director of a community clinic or a not-for-profit. They can become an officer in their dental association. One of our graduates is the president of a dental society in a northeastern state now, just since he's graduated dental school because of his skill set. So we prepare these young men and women to come out of here with skills, with their abilities and credentials that they can emerge as leaders within the health profession in this country. You know, being a part of what ASDOH has become and what A.T. Still University has been and is growing to be more of is an extraordinary feeling for me. You know, as a public health guy and someone who has had a career of service, public service, and now academics, it's provided me an opportunity to realize a dream and to see that we all can make a difference, that we can solve problems, improve health, and really through other people, through the young men and women that we interact with, ultimately improve the world we live in, one patient at a time.